Afternoon, everyone. So we will start our session on 2 p.m. So see you guys later. Good afternoon, everyone. Thank you for you guys to join our session today. So I'm the MC of today, Jen, and before we start our talk, how NK cell immune booster helps on infectious disease. So let me briefly introduce our guest speaker, Dr. Rashban Singh. So, Dr. Rashban is, sorry, let me repeat again. Sorry. So, Dr. Rashban in 1995, he established the first geriatric ward in Malaysia at Hospital Seremban. He was the first geriatrician in the Ministry of Health. Dr. Rashban is member of the Elderly Committee of the Malaysian Medical Association, member of American Academy of Anti-Aging Medicine, and member of the British Geriatric Society. He is founding member and past president of the Malaysian Healthy Aging Society. And he is also a certified nutrigenomic practitioner and international medical advisor to the Fijians Australia. And he now heading the Malaysia Wellness Society as its president. Presently, Dato Dr. Rashman is a medical director at the Roret Wellness Center. He has been invited to give the numerous talks on healthy aging and wellness in different countries. Besides, he has also written numerous articles on health and wellness related issues in local publication. Furthermore, Datuk Dr. Rashban also a regular radio show every Thursday on Light FM where he speaks on various health issues. And he believes in the motto, live long, live well. So actually, let me also introduce to you what is a Malaysia Wellness Society. And I believe most of you hear this and know about this, but let me also briefly introduce to you guys. So Malaysia Wellness Society was formed in 2005, and Malaysia Wellness Society is a non-government or NGO and is non-profit organism. It was set up by a pro-team committee made up of medical professionals and non-medical professionals who are passionate about wellness. The mission and motto of the society include integrative and proactive approach towards wellness for all. Ladies and gentlemen, now please join me to welcome our guest speaker, Datuk Dr. Rashban Singh.
Yes, good afternoon. Thank you, Jane, for inviting me, and of course, the organizers and uh, the laureate for asking me to speak today. Now, I could just talk a very brief talk actually on how we should strengthen our immune system, what we have learned from our own sort of physiology, and what the new trends are coming up. So, I think in times like this, it's very important, with the current pandemic, and over the last 6 months, you've seen how a virus can affect all of us, and also that the people who seem to get affected the most, the people who have the highest amount of morbidity or mortality, or people who die from this virus, are people with the low immune system, people with chronic disease, people with things like diabetes, hypertension, kidney disease, people with cancers, the older population. And all this shows that if your immune system is weak, you're more prone for this infection. You can get a more severe disease. Of course, the COVID is here. We don't know when it will go away, but when it does, in years to come, there'll be another virus that will come again, right? So we always have to be prepared, and you can't prepare your immune system overnight, so it takes time for you to build a strong immune system. So I'm going to go through very fast over some of the things you can do to build up the immune system, and then some of the new technologies that are coming up that can support us and help us. So, not moving. The slides are stuck, so please bear with us for a while.
This wait for a while, but before that, maybe we can, yeah, if you guys already had your lunch, yeah, maybe you guys can share with us while we're waiting for the slide, next slide. Yeah, good afternoon, Aaron.
Okay, so we are back on. So let me talk first about the immune system. Now, if you look at our immune system, actually we got one of the most powerful soldiers that actually defend our body. Now, the immune system consists of a lot of things: the B cells, antibodies, things like your killer cells or natural killer cells, which I talk a lot about later, right? Yeah, and what it protects us against is basically all sort of viruses, bacteria, and cancer. Anything foreign to the body, the our immune system is the one to look out for us, go out, catch it, and kill all these cells. So, and so whenever a new cancer cell is formed, while right now, while a lot of you are sitting there and listening to my talk, you are having cancer cells formed in your body almost every second, right? Why we don't all of us get cancer is because our immune system will take care. They're like the Jedi of our, you know, body. They will take care of all the evil things that are attacking our body, and they will get rid of it. Now, but what's happening today, we've realized is that a lot of times the things we do to our body is what makes our immune system weaker. And that's when I want to talk about the concept of the difference between wellness, health, and sickness. See, a lot of us think we are healthy. And what is health? Health is basically the absence of disease. So all of us are healthy, walk around doing things until we get a crisis and then go into a sickness, right? Whether it's just your blood pressure going up, or whether it's your cholesterol going up, whether you're putting on weight, whether you get a joint pain. But the moment you move from health to sickness, it becomes a crisis. You end up seeing a doctor who will then probably put you on a medication. The medication doesn't cure you, it just controls the symptoms, controls the disease. The moment you stop the medication, the disease will come back. So that's very reactive. Wellness is different. Wellness is things you're doing proactively every day to prevent the disease from getting in the first place, from getting the disease. For example, what are you doing every day today to make sure that you have a very strong, powerful immune system? Are you doing the right things to get your immune system strong? And that's one of the things I had to talk about today. We must start thinking of prevention, thinking of proactively doing things so that we don't talk of sickness anymore, right? Not just health, but wellness. And that's what I talk about. Now, first of all, what depresses our immune system? And that's where the biggest problem is today. Today, a lot of us are doing things that will cause our immune system to get depressed, right? We have a lot of nutrient deficiencies. We eat a lot. Today, food is so abundant, but we eat a lot of things that are not nutrient rich, right? We eat a lot of empty calories, a lot of refined carbohydrates, a lot of saturated fats, and that actually makes our body weaker, make the immune system weaker, right? Today, got a lot of contamination, right? We got contamination in the air, our water, our food. We got a lot of pesticides, insecticides. Now, no choice. We all have to wear masks. We have to do sanitization. But all these are chemicals, and this will cause problems in the long run. We got unhealthy lifestyle, smoking, alcohol, and all those things. And your emotions, negative attitudes, emotions, all these will depress your immune system. And then there's toxic metals, toxic chemicals, toxins that comes into our body from all the things we are using, right, to feel better, to look better. But these are all toxins. Then comes lack of rest and sleep, too much of stress, even too much of exercise, because exercise should be moderate in balance. Too much will also cause inflammation and decrease your immunity. So what I'm going to talk about is just 5 things late after these, 5 simple things, right? Very simple, but I would say not easy to do. And this is very important, right? The 5 things that I'm going to talk about that will help build up your immune system. Now, the first thing that we should do to strengthen the immune system is again our mind, right? Today, we are here not only physical, we also non-physical, metaphysical. That means mind, body, spirit, right? So we talk a lot about the physical, the body part, but sometimes forget about the mind and the spirit part. And those are things that will, if don't do, like I told earlier, negative emotions will depress your immunity, right? So to strengthen the immune system, the first thing to work on your mind and your spirit. So positive mental attitudes, having a purpose, goal setting, all these actually help build up immune system. Now, today, from the morning itself, you get bombarded with news from all over. And I tell you, some of the time, this news, or most of the time, I would say that most of the news that come to your handphones or your, wherever, your laptop or whatever news you're seeing is most of the time, 80-90% is mostly negative, right? And that can sort of create a negative mental attitude, create negative emotions, make you anxious, make you depressed, make you worried. And that can spiral out into a everyday affair. And moment you go into negative emotions, moment you are positive from positive to negative attitude, your immune system is going to get weaker. You'll be surprised. Your cells listen to everything that you do, how you're thinking, how you're feeling, what you're eating, whether you're moving, exercise, whether you're stressed up. The cells listen, right? And that's including your immune system. So wrong things, wrong attitude, negative emotions, your immune system gets weaker. So the first thing you have to do is have a positive attitude, and things like goal setting, purpose, getting excited about life will actually make you not only age better, prevent disease, but also build up your immune system, right? So that's number one. Number two, Malaysian favorite, thy food is thy medicine, thy medicine is thy food. Hippocrates said that a long time ago, right? But today, a lot of us have actually changed the way we are eating. We have stopped eating natural foods that are wholesome, right? Foods that are, full of vitamins and minerals and phytochemicals. Today, we got a lot into refined foods that are man-made, foods that are high in chemicals, food that are processed, food that are preserved, food that are full of toxins. So that damages our body, right? So second, number two is to change the way we eat. Now, what's interesting is the same things that I'm talking about that will build up your immune system will also help you prevent all the chronic diseases. If you have a positive attitude, and number two, if you eat right, if you eat a food like what the Mediterranean people do, the Okinawans, the Blue Zone people, right? A food that is high in, fruits, vegetables, high in good fats, high in fiber, high in a lot of vitamins and phytochemicals, but low calories, right? You will find that you will have a better immune system. On top of that, you probably will also have a healthy weight. You also will have prevent all the metabolic diseases that I talked about earlier, and your chance of getting diseases like cancer and dementia and strokes also will be reduced, right? And heart disease. So number two is change the way you eat, right? I would advocate all of you all to go up and look up the blue zones, the 5 places in the world: the Mediterranean, the Okinawans, the Sardinians, the Icarians, and the Adventists of America. They've studied them for the last 20, 30 years. People in these areas seldom get chronic disease, have a very long life. They're the longest living centurions around. And it's just one of the things they do is the way they eat, right? So one number two is change your diet. Go natural, go foods that, I say that your grandmother could recognize. Don't take all the foods that are today man-made and, full of chemicals and toxins. So number two is the way you eat, right? Make smart dietary choices. Number three is exercise. Now, exercise is actually something that every one of us should do. We are meant to move. Humans are meant to move, just like a car. You can't just leave a car and not start it. It will get rusted. Same with our body. Our body is meant to move, right? I call it the best buy in public health. And the benefits of exercise I'm not going to go through, but one of the benefits of exercise is basically it will build up your immune system, right? The right amount of exercise, balanced exercise, moderate activity. Now, don't go extreme. If you go extreme, it will increase inflammation, right? Unless you're doing it for sports or for whatever reason, a challenge, okay. But regular times, I would stick to moderate exercise, right? Because over exercising will actually cause a lot of inflammation. If you look at the exercises that we do in Asia, from things like Tai Chi or Qigong or yoga or Silat, they actually are not very strenuous, right? But they got very good aerobic, they got very good strengthening, they got very good flexibility, and they also strengthen your core muscles, right? You don't have to run a marathon to get the benefit. So I think we should go back to basic, simple exercises that will include some aerobic cardio, some strengthening, some flexibility, and making your core muscles, your front and the back strong. And this will, if you do this, you will also help build up your immune system. So number three is exercise and the right amount of exercise. Four, stress. Acute stress important. If you come across a snake standing in front of you, you want to run as fast as you can to prevent being bitten by a snake. So that is acute stress. You need to release the adrenaline, the cortisol for the short period. But today, most of us have gone into chronic stress, and we have come to a situation where we are releasing our cortisol levels continuously From morning, we get up with the alarm clock, and that itself starts the stress, and it carries on throughout the day. And when cortisol is continuously being released, one of the things that cortisol does is basically reduce your immune system, right? Also will make you put on weight, also will cause a lot of the metabolic diseases, especially if you don't exercise and eat the wrong food. So stress is very important, right? It can contribute to a lot of diseases, but one of the things it does is to reduce your immune system, right? And today with all the technology we have, you're completely forever been bombarded. Actually, our stress levels actually do go up, right? And I think we have to really learn how to manage our stress. Important. I would look again, if you go back to the first thing, have a positive attitude, learn things like mindfulness, meditation, prayer, whatever, right? Learn to manage your stress. Number four, stress is something that will decrease your immune system, right? Number five is sleep. Sleep is very important. 6 to 8 hours is the magic number. Less than six, not good for the immune system. More than eight, also not good for the immune system. It somehow suppresses the immune system if you sleep too much, because you are supposed to move. So if you're sleeping too much, that's not very good, right? So sleep is important, and especially, you yourself will know when you get up in the morning whether you're fresh. If you're not fresh, that means you're not having enough sleep. I find that for me, 6 to 7 hours works well, but you must see what works best for you. But at least 6 to 8 hours is the right amount of sleep to maintain your immune system, keep it strong. Now, I just want to talk something about natural killer cells. Now, these are, the name itself implies, killer cells, and what natural killer cells are the ones in our immune system. They are a type of T cells that actually looks after two things in the body. It will kill any virus that enters our body. Not only will it destroy the cell that is harboring the virus, it will also kill the virus. And number two, it will kill any cancer cell that is found in the body, right? So the NK cells are going around and they don't wait for anyone to activate them. The moment they even suspect there's a virus in that cell or they suspect it's a cancer cell, they will destroy it, right? And that's important. But and if you look here, this is what it does basically. It will, NK cell directly kill cancer cells, and it will destroy the infected cells that are full of virus. But what we have seen from our studies and our research is that most of us, as we get older, and even now younger people we see, as we just NK cells level, we find that most people, NK cells are only about 10 to 15% of what they're supposed to have. That means most of us have a very low NK cells in our body. And because our NK cells are low, we are much more prone towards getting a viral infection that we cannot cure or a cancer that will suddenly flare up, right? So have you seen the COVID in the last 6, 7 months have shown us exactly what it means, that if you have a chronic disease because you didn't take care of your attitude, your emotions, you didn't take care of your diet, you didn't exercise, you were stressed up, you were not sleeping well, has all this happened, you probably had a chronic disease, right? Most of it starts off with metabolic diseases, right? If you have a chronic disease, or if you have a cancer, or as you get older, your NK cells will drop anyway, right? All these were causing your NK cell level to drop. And because of this, your immune system is weak. There are not enough NK cells running around to fight all the cancer that is formed in the body. And because of that, your NK cell levels are low. A virus comes into your body, you have no chance to fight it, right? That's why the younger people who are better or healthier people seem to have, asymptomatic carriers. They get the virus, but nothing happens to them. But those with chronic disease and those who are, with poor immune system, they get a very severe disease, right? So I'm not going to talk too much about it. Today, we actually can look at your NK cells level. Today, we actually can give you NK cell infusion if your levels are very low, right? As a preventive booster, while you work on your immune system, right? So the immune system is actually in a very delicate balance, right? So you have to keep it strong. And like I said, the simple things I told earlier, having a positive attitude, eating right, exercising correctly, managing your stress, having enough sleep, looks very simple. But between you and me, it is not easy to do. How many of us can actually stay positive the whole day today with all the news being bombarded at us? Not easy. We all love our food, right? And most of us eat not because of the, the nutrients in the food, but because of the taste. Like I say, we eat for our tongue. We love to eat food that is so-called tasty. But most time the tasty food might not be the healthy food. We have come actually a very lazy society. Right, today we use everything. We just press a button and the gate will open, the television will open, computer opens. We have stopped moving a lot. We are moving around, sitting down and looking at our handphones most of the time, or our laptops. So we have stopped moving. And because of all the things we are going around us, we are actually a very stressed up society today. And all these together will help us or make us get a poor sleep, right? And on top of it, we love to sit up at night and watch our favorite pastime, or watch football games at stream at 2-3 in the morning, and so our sleep is affected. But you must be very careful, because if you don't take care of your immune system, it is going to come back and harm you, right? So we should, like you send your car to a mechanic to regularly balance it to make sure that it's running well. Same thing should happen here. You come and get yourself, go through a program that will help you realize where you are. Things like doing your blood profile, looking at your blood pressure, looking at your markers. Today you got even things you can gadget you can wear that looks at your heart rate, your sleep patterns and everything. You can even get your DNA checked. You even check whether your NK levels are high or low, and all these can help you to see whether you need something else to help you improve your health, so that you can live long and live well. Right, with that I'll stop. Thank you, and I'm open to any questions that you all have. Back to Jane.
Thank you, Dr. Rajpan. So yeah, if you have any question, please just drop your question in the chat box there, so we can answer you. So besides, actually, doctor, I received some question from the participant. The first question is NK cell suitable for the cancer patient?
Yeah. Now, for the few things that you must understand when you're having cancer. Now, NK cells are what we do is you take your own blood, right? And then we send to a lab where they culture your cells, and get your NK cells to at least more than 1 billion cells that we can then give you back to help clear up your body from any viral infection or cancer. Now, if you already have cancer, it's not the right thing to do, with NK cells, because you want to treat the cancer first. Now, some people do take NK cells because their therapy has failed. That means their oncologists have said that now they can't treat the cancer. The therapy has failed. Then sometimes there's an option they might try NK cells. But what we are trying to do here is more for prevention. That means if you have a strong family history of cancer, or if you're recurrently getting infections, your immune system is weak, you want to boost up the immune system before you get into a problem like cancer or a bad viral infection, right? Then you can take NK cells, right? So that's how we will do it. Or sometimes patients have been treated for their cancer. The cancer is so-called been cured now, but you always worry whether you're going to get a relapse, right? And these are the patients who might want to then take NK cells to boost up their immunity so that the cancer doesn't relapse, right? But if you've got active cancer, you should get it treated first. You don't take NK cells.
Okay, thank you for doctor answer this question. Another question is, what is the ideal age for the NK cell therapies?
Actually, there's no ideal age. If you have a risk factor, let's say you have a strong family history of cancer, and you are, even if you're younger but you are worried, we can actually check your levels of NK cells, and if they're low, we can give you. I thought it's your own blood. We're not giving you anybody else extra. It's your own cells that we're going to culture and come back to you. So it's very safe, right? But I wouldn't give to children. I think anyone above 20 should be okay for if they have a reason to take NK cells. But most of the people are definitely above 40. We find, and especially if they have chronic disease, we find the NK cells level are very low. They are the ones who actually will benefit from this. And of course, the older you are, the lower your NK cells, the more the reason for you to actually look at this therapy.
Okay, thank you for answering that question. And another question is, what is the difference between NK cell and stem cell?
NK cells is basically natural killer cells, which is an antibody that you are taking to build up your immunity against especially cancer. Of course, recently because of COVID, people also start looking at viruses. Most of the time, NK cell therapies was used actually for uh, some alternative therapy. People actually use it to treat cancer, but we are using it to prevent you from getting. So it's more of prevention to boost up the immune system so that it can stay healthier longer. Where stem cells are different. Stem cells are young cells that are used to repair and regenerate. If you get a cut in your body, after a while, a small cut, it will heal by itself. How does it heal? Because your body releases stem cells that come and repair, right? Again, with age, your natural stem cells will decrease. They will not be as strong as before. They won't be as good as before, and the numbers will decrease, and that's why we age. So the theory is that if I can give you young cells from, let's say, a baby, these are not your own cells now, these are from somebody else. And stem cells are immunogenic, that means they don't cause a reaction. So anybody can take anybody cells. So if you take a young cell that is still from a baby cord, let's say, so you got a young cell entering your body, and this will go and repair and rejuvenate and regenerate your organs in the body. So basically, it sort of slows down and delays aging, right? So one is more for its repair and regeneration and rejuvenation. One is to build up the immune system.
Okay, thank you for that. Another question from for how long can the NK cell therapy last in the body?
Again, depends on your lifestyle. Now, NK cells are used up very fast. That means they will, within a few weeks, they will go away. What they have done is they've probably cleared up your body of all the whatever cancer cells are there or any viruses that are there. So your natural NK cells that are still in your body have now less work to do, so you can last longer. But if you have a high risk factor or your immune system is really low, then you're looking at boosters maybe every 1 to 2 years. Also depending on your lifestyle. If you've got a very unhealthy lifestyle, you're going to be in trouble faster. So I would actually advise you to change your lifestyle. Whereas again with stem cells, different stem cells, people can, if you've got a good lifestyle, you only might take the next one or booster after 5 years, right? So NK cells are something that, depending on your risk factors, and your lifestyle, might be more frequent compared to stem cells.
Okay, so is the NK cell therapy suitable for the old people also?
Yeah, definitely. In fact, they are one of the main. If you're worried of, the older you are, the higher risk of getting infection and also cancer. So they are the ones, and their NK cell levels will definitely be low. So they definitely will benefit the most.
Okay, yeah, someone is wonder, is the stem cell therapy good for the prostate enlargement?
I think stem cells actually more of repair, regenerate. It won't disturb the prostate, but I don't think so. It will make the prostate get smaller. So it was right. So it won't help there. Um, but let's say if your prostate is not healthy, yeah, it will help to repair that. But it will not make your prostate get smaller.
Okay, so what is the procedure for the NK cell therapies?
So basically, what we do is we just take about 100 mils of your blood. That's your own blood, and then we send it to a lab where they culture. It might take anywhere depending on how your number of NK cells in your body. If you've got very low and they're not very healthy, it might take longer to culture. But basically looking at 2 to 3 weeks, roughly 2 to 3 weeks. Uh, but if they are low, then it might take longer. But roughly 2 to 3 weeks, we can culture about 1 billion to 1.5 billion NK cells, and then these are infused into you over an hour. Just an infusion, IV infusion, intravenous, that are given over an hour. Because they are own cells, normally there's no problem. There's never had, so far we never had any issues.
Okay, understood. So after NK cell therapies, do we still need supplement?
Supplements, again, you can sit down and when you come, uh, the doctor or like here we even have our own holistic nutritionist, and we have a holistic practitioner who will actually advise you. So when you come for this, before we actually advise you 2 weeks before, we want you to see our holistic practitioner. We want you to see our dietitian, so they will advise you the diet you should follow. So when you come to give your blood, we want you to follow a strict regime for 2 weeks if possible, right? What are the healthy things you should eat, what you must do, and maybe even suggest some supplements to keep build up your immune system to help you stronger. And then once you take the NK cells, we want you to do that for another 2 weeks or even longer if possible to build up. So depending on your profile, you might not need supplements. All we will advise you definitely of the 5 things I talked about. You know, at least 2 weeks before the NK cell infusion, you must eat healthy, stay positive, you know, reduce your stress, do some exercise, sleep well, so that when you come for that NK cell infusion, your body at least is prepared to accept that, you know, it's more healthier, so the NK cells will work better.
Okay, so my relative just finished the chemotherapy. Could he proceed the NK cell or stem cell? If can't, how long need to be wait?
Yeah, okay. Now, depends on whether the doctor has said that there's no more therapy anymore. That means there's no more radiotherapy, chemotherapy, or whatever. And so once that is completed, for NK cells, after maybe even after 2 to 3 months, he can take NK cells. Stem cells we won't give until at least you're 5 year cancer free. You know, so stem cells are different because stem cells actually regenerate. So you don't want to disturb any cancer cells. You want to be at least 5 year cancer free. But NK cells, even after 2 3 months, you can actually start NK therapy to build up the immune system.
Okay, so another question is, let me have a look on the questionnaire there. Yeah, again, what food can boost the NK cell if they want to boost it naturally?
Uh, Basically, if you look at all natural foods, things like your fruits and vegetables and all that, foods that reduce inflammation. So things like if you take your all sort of herbs and nuts and all these can. So I think to boost up naturally, it's basically you must make a healthy environment in your body, and that goes back to eating healthy. So any things like all plant-based diet. There's a lot of people in the blue zones are plant-based. So plant-based diets are very important, right? That's the foods that improve your, like the herbs and spices or reduce inflammation, that can help your NK cells. Good fats like taking, you know, fatty fish or avocados and all that will help your, and some good proteins, you know, will help your NK cells to strive, because proteins form your antibodies, you know. NK cells are formed from amino acids. So these are some of the things. So it's back to a healthy, natural, plant-based diet that will really help your NK cells.
Okay, thank you for answering that also. So how many injection we need to proceed for NK cell of stem cell? Any reaction after doing NK cell or stem cell?
So far, we got no problems. You know, some people have a local, some slight pain if they have for stem cells, but NK cells, your own cells, we never have any issue. So far, we have done a lot of stem cells, and all over the world today, people are doing research on stem cells. So when you do research, that means the first thing they do is phase one. Phase one means safety. So once phase one is over, then we do research into disease. So phase one has been over for a long time. So that means we are very safe. So there's no problems with using stem cell. Safety trials are.
Hello? I think Dr. Rajpan is his line is not good. So please wait for a moment. You can still put your question in the chat box there. So we will answering you soon. Please wait a moment. Dr. Rajpan will coming back soon. So if you have any question, you can just drop in the chat box and we will answering you soon.
Yep, you're back.
Just now the lines break down. Doctor, can
Yeah.
you repeat again your answer so the audience can have So I repeat again the question. So how many injection we need to proceed for the NK cell or stem cell? Any reaction after doing the NK cell or stem cell?
Yeah, so you just take one injection. That means you, like for NK cells, you take your blood after 2 weeks, we just infuse over 1 hour. So it's just one injection. Same with stem cells. Uh, but stem cells you run a bit longer. You normally run the infusion over 2 hours. And so far like there's been no problems with any of them. Uh, Already we have done a lot of trials of safety trials have been completed all over the world. So uh, they are actually very safe to use. NK are your own cells, so no problem. Stem cells. Now we are doing research into phase 2, phase 3. So that means safety is not an issue anymore. Now we're looking at efficacy, whether it works for things like whether it works for heart disease or diabetes or Alzheimer's. But we are doing for wellness. So wellness is very safe. That means there's no problems with that.
Okay, so another question is, does this NK cell can help on COVID-19?
Uh, the thing is, if you use NK cells, basically your immune system will be stronger, right, or better. So hopefully, if you get exposed to COVID, your immune system can actually handle it better, lah, right? But if you already got COVID, then too late to do NK cells, because it takes 2 weeks to culture or 3 weeks, and the 2 weeks is where the COVID is either you recover or you won't recover, lah. So if you got COVID, there's no way you can do NK cells. It's already not going to work, So it's more like you take it to prevent, and hopefully, if you're done it and your immune system will be stronger, and if you do get exposed to COVID, your immune system can handle it. Remember, right now, if you look all over the world, people with low immune system are the ones who are getting severe disease and dying, right? The one with good immune system, nothing happens.
Okay,
So I
so
think that's important, yeah.
okay, understood. So how do I know if I need NK cell therapies? Is it any like best therapies for me? How can I know?
I think the best is you can make an appointment and see us, and then we can
Okay.
go through your history with you, your lifestyle, and then we can then see whether it's something that you can consider. We're not going to give everybody. If you're already someone who is very healthy, you got no risk factors, you are no family history of any issues, and you're daily taking care of the 5 things I spoke about earlier, then we think you are maybe someone who might not really benefit from this. But if you think that you are not having a healthy lifestyle, you're getting recurrent infection, your family history is a lot of cancer in the family, and you find that you fall sick very often, then you must really seriously look and see whether this is something that will benefit you.
Okay, thank you for answering that. Another question is, should I repeating to take the NK cell if I just did the NK cell therapies last year?
Actually, yeah, if you're more than a year, then you can consider again. Uh, but then again, you have to come and see whether it's going to be beneficial for you. Yeah.
Okay, so can the diabetic patient proceed the stem cell treatment? Will it be recover totally?
Uh, no guarantees, because stem cells we cannot guarantee. A lot of research going on whether there are some positive things for diabetes, but I think all depends on what organ is affected. Stem cells today are not targeted. That means they're general. So if we give you stem cells, they might not actually go and repair the pancreas or diabetes. They might go and repair some other organ which is actually more damaged, that is more important, for example, your heart or your lungs, right? So we cannot guarantee, but there have been the studies so far that shows that people who take stem cells, their sugars actually improve, right? So there is some element of repair that the stem cell do, but we cannot guarantee because we're not targeted yet. Maybe in 5-10 years time, we'll have targeted specialized cells that will be the next generation of stem cells, where we can have cells that will repair the pancreas or repair the heart or repair the lung. When that technology comes, the specialized cells, then we can be more sure. Right now, we are using general cells, so we cannot guarantee, but there are some studies coming out that show that yes, diabetes can improve.
Okay, thank you for answering that. Uh, from the floor, where is the lab and is this lab qualified?
We got actually 4 labs in Malaysia that are, in fact, now there are 5 labs in Malaysia that are certified by the Ministry of Health. They got GMP certificate, right? So that is not an issue. We use labs that are got certification. Not only the labs in Malaysia, not only are certified by locally, they also got European and American and Australian certifications. So they are actually very high standard labs, and it's not cheap to get these labs. It takes about 40-50 million to set up one lab. And to go into the labs, you must, to enter the lab itself, if you're going into where they make the cells, you must wear like an astronaut and go in. So very expensive. These are, high tech. A lot of these labs have got very high standards. Uh, in fact, if you are interested, we can take you to the labs we use to show you uh, how how they culture, what they do, what standards they have, right? So, uh, of course, you must be very careful that because a lot of people out there who say that they use stem cells, we must be very careful where they're getting it from. As long as they're getting from a certified lab, and actually you get a full certificate when you're taking this. They will give you the full certificate of how many cells where, and they will tell you that they have cleared the cell of any infection, any mutations. So that certificate must be given by the lab, right? So always make sure that if you're taking any of these therapies, they are from a certified lab, and that you get a certificate to tell you that what you have taken, right? So that's very important. So yeah, you don't have to worry about the labs, and if you're interested, we can actually go and show you uh, the lab and see the ones that we use, so you can be actually more confident.
Yeah, okay. Yeah, a lot of question here, so please wait a moment, let me check. So is the stem cell treatment good for rejuvenate?
Yeah, I mean, that's what a lot of people are using stem cells for rejuvenation. Right now, it's more for prevention, wellness. Hopefully, in the future, with more research, it will use for therapy. But right now, we are actually looking more for, you know, um, there we will age. But the question is, can we slow down that aging process? And that's what we are looking at, all the different ways to, help us. It's not living longer, but living healthier, right? So you want to
Mm,
be 90 or 100. If you want to live that long, you want to make sure you're healthy. You don't want to be bedridden or in a wheelchair bound, or you can't remember who you are. We don't want that. We want to be healthy, and that's where all these whole wellness programs are all about. From our DNA to our lifestyle to therapies like NK and stem cells, is all preventive wellness programs, right? We're not we're not focused on disease, because once you get disease, a different area. Looking at what we can do to maintain your health and wellness, that's most important.
okay, so stem cell treatment therapies can help on the hormone imbalance.
But yes, definitely, because your hormones will go low as you get older. And also, if your lifestyle is not good, we got people in their 40s and 30s I've seen whose hormones are completely haywire and down because they don't do all the things we spoke about, the 5 things earlier. So yes, stem cells will help in balancing the hormones. They're one of the first things we see actually.
Okay, so another question is, if we would like to live like the blue zone people, right? So any recommendation for us as we are in Malaysia?
It's okay. Blue zones is a concept. It's nothing to do
Okay,
with the country or the food. It's a concept of where you are, right? So whether you're Mediterranean or the Nicoya, Icaria there in Europe, the Okinawans are in Japan, the Adventists are in America, you know, and the Nicoyans are in South America. So it's everywhere, So we got Asians, we got Europeans, we got South Americans, we got Americans, right? So it's not whether who you are, is the concept of what they do, right? So the whole thing that the blue zones do, from the way they think, from the way they socially integrate, from the way they have purpose, the way they eat, the way they exercise, the way they are spiritual, this thing where they how they interact with their family. So it's a whole thing. So go back, just Google blue zones and talk about how Dan Butner, the guy who discovered the name blue zones, how he went and studied this. You can go on YouTube and see his videos. Simple things they do. They're nothing rocket science. They're doing simple things that are making them live longer. My problem is we are doing all the opposite things, right? Uh, Malaysia, we love our food. We are full of negative emotions, and not only Malaysia, but all over the world. We don't have enough sleep. We don't get full of stress. We got no time for exercise. We're doing exactly all the opposite things of what the blue zones are doing. So why don't you go and study their culture, right? Because sometimes in my talks, people get up to tell me that, oh, you are Malaysians, we are not Okinawans or Mediterranean. No, it's nothing to do with Okinawa, Mediterranean, or Adventist or what. It's the concept, the culture. You can do the same thing in Malaysia. It's just the concept that you do, right? We all can eat healthy. We also got a lot of foods that are full of plant-based. We all can have positive attitude. We all can exercise. We all can manage our stress. We all can sleep well. We all can interact well with our families, right? And it's a concept. So nothing to do with the country or the people. It's a concept that you can follow, right? So if you can follow the blue zones, right, then you're going to age well. And if you still think that you're going to do better, then you do things like NK and DNA and stem cells and all that. But remember, if you have an unhealthy lifestyle, you can take all the NK cells and the stem cells and do all the supplements, it's not going to work because your foundation is your lifestyle. So you keep your foundation strong, you can do all the extra things to help you even get better. That's all.
So let's
Foundation
us
is the best.
yeah
Yeah.
yeah so yeah, hope you doctor have answered Dato have answered your question. So let us stay healthy and then live long, live well. And another question is, what do we need to do before proceed and get out?
I mean, the first thing, of course, is we will have to see us and we'll go through a full history, make sure you're eligible. And then if you are, then we do a full blood profile to make sure that you're free from, like if you're uncontrolled diabetes, you've got high blood pressure that's not controlled. Let's say you end up, your test shows that you actually got a cancer, then you're not eligible for the treatment, right? So before we do that, we will do a full examination, a full history taking, full blood profile before we go ahead and see whether you can take NK cells or not. So you have to come and see us, and then we can then go through the whole procedure, what to do.
Okay. Okay, no problem. So the time is passed very, very fast, and now we have balanced 5 minutes only. So, Tato, do you have any like recommendation or any words before we end and want to tell all our participants today?
Yeah,
Yeah.
I think if the most message you must get is remember the 5 things that I talked about. I think that's your foundation, right? Because that's the key. Everything else that you're bringing to the table, the technology of whether we can do DNA profile, or whether you take extra supplements, whether you take NK, stem cells, all that is of no real benefit if your foundation is not strong. So I want you to go back today and start asking yourself, do I have a positive attitude or not? When I get up in the morning, am I excited about life or am I depressed about life? Right? And start changing. So like I get up in the morning and I read 10 minutes a positive book every morning, 10 to 15 minutes, I read a positive book. So I have all of that books with me in early morning in my bed, near my table. I go to also the positive book. So I read that. I start off with the exercise for 10 minutes in the morning, 10 to 15 minutes. Every day I exercise, right? So and then I try to have a plant-based diet, and because I do these things, I eat positive, I do this, I try to manage my stress, and I make sure I get my at least 6 to 7 hours of sleep. Now, these are habits that you must form from today. Now, because your immune system is not going to get better overnight, it will take, if you do the right things over the next 3 6 months. So start asking yourself this and start forming these new habits every day, right? Start with maybe reading something positive, start with some exercise, start eating more vegetables and fruits in your diet, add that in, you know, and then start to manage your stress and make sure you get your sleep, right? So all these will start step by step, get your foundation strong, and then after that, if you still think that you need something else to keep you even better or booster, then you can look at all the new therapies that are coming in the, that are available now, right? But foundation is the key. Don't forget the foundation.
Thank you for Doctor. You're sharing so much with us today. So yeah, don't forget, the most important is we need to have a strong foundation. And so if you guys have any question or interested to know more about the NK cell, you may contact the number in the chat box there. So hope you guys have enjoyed the session, and thank you, Dr.
Thank
Dr.
you.
Rajban.
Thank you, Jane.
You give us such a nice sharing session, and so hopefully, yeah. Yeah, thank you, Aaron, also. Thank you, Amanda. Yeah, so yeah, we hope to see you guys in the next talk also. So thank you, doctor. So our
Thank you.
session
Bye.
going to end now. So see you guys again. Bye.
Bye.